Hello and greetings from Oakland, California. My name is Michael Arnold, and I'm a director with Informing Change. I'm also an ACE Evaluation Network member. As you heard in the previous videos, Dr. Donna Mertens discussed differences between CREE and non-CREE practices, as well as different methodologies that we can apply in our CREE approaches. I want to discuss a little bit about what I see as the shared approaches that undergird these differences across CREE and across working between evaluators and funders. So stay tuned, and thank you for joining. There are three fundamental features of CREE. As CREE practitioners, we center equity in what we do and how we do it. We take a systemic lens to our work, incorporating structural, historical, social factors that influence the outcomes of the work. We're participatory in our practice, engaging different communities, individuals, and other stakeholders who are affected by the work and by the outcomes. But with all of this, there are a multitude of ways that we can actually engage in the practice. There are different ways that we center equity, wildly different ways that we take in and understand systemic approaches to the work. And there are different levels and ways of engaging in participatory practice. Given all this variation, what describes our shared approach to CREE? There are three aspects of our approach that I've seen in the work I do, as well as others in CREE field. The first is that we're intentional and transparent. Second, we're methods pluralist. And the third is that we are reflexive in our practice. Being intentional and transparent means that we clearly and openly articulate where we're coming from and where we're going. Nowhere is this more important than when we're thinking about how we center equity. For example, on any number of health outcomes, Black Americans fare far worse than non-Hispanic whites. As an equity issue, this has more to do with structural and social context than it does with individual behavior. But stating this as an equity issue doesn't necessarily lead us all to the same equity solution. For some, the equity issue is about imbalances in an otherwise fair system. So improving things like access to Medicaid and providers will help restore a fairness and balance in our health system. For others, the way our health system is structured and health is produced in this country is fundamentally inequitable. And so restoring balance within the existing system doesn't really change equity at its heart. And what we need to do is start over, rebuild our healthcare system, rebuild the way we produce health. This is a radical rethinking of healthcare and may be fundamentally what is needed to produce an equitable system. But these two sides need to dialogue in order to understand which direction they're coming from and to really understand what works and what doesn't in producing health equity. Being intentional and transparent about our definitions of equity and how we're centering equity in our work is not a nice to have, but a must have in our shared approach to CREE. Methods pluralism is a core feature of cultural responsiveness in that it forces us to rethink and reapply our understanding of validity and reliability, and understand them as not externally derived, but driven by the experiences of those we engage. I use the term methods pluralism to describe not only that we have a variety of approaches that we can take in CREE, but that none of these approaches on the surface is the only or the best approach to be used in all types of situations. This perspective necessarily differs from more traditional evaluative designs that consider randomized controlled trials or quasi-experimental designs as the gold standard in understanding evidence. In these more traditional approaches, context, culture, and ways of knowing and meaning are summarily removed in order to obtain a more presumably objective measure of effect, impact, or correlation. For CREE practitioners, however, context, culture, and meanings are central and important to understanding what works and under what conditions. In CREE practice, methods pluralism is not just about having multiple options of ways to gather and interpret information, but it's about taking context and culture seriously in the ways we understand the validity of those approaches for various individuals, groups, and communities. Methods pluralism is our cultural responsiveness. As CREE practitioners, we are in a constant state of evaluating and reassessing our approaches to our work and the ways in which we engage others. These refinements and adaptations are spurred on by us being reflexive in our practice. That is, learning not only from our findings, but learning from our own experiences. We take stock of how our thoughts, our feelings, what we've experienced in the moment of conducting the evaluation of our work, how all of that is reflected and influences what we do and what we create in our practice. But similarly, as reflexive practitioners, we must place value on the experience of others. How our clients, the communities, and other stakeholders we engage may have read or listened to our findings and understood them, how they felt participating in our work and our studies, and what they think about our definitions of equity and about the way we're trying to move equity forward. Being reflexive in our practice is one way to avoid the pitfalls of extraction and abstraction in our work, and a way to raise validity and value add of the methods we employ through CREE. I've highlighted 3 approaches I believe are shared in all of our CREE practice: intentionality and transparency, methods pluralism, and reflexive practice. So how do we implement these in practice? And what is shared between funders and evaluators in this work? I want to bring up some questions in the next clip around what we might think of when we think of moving forward together as evaluators and funders in the CREE space. So please join me for the next discussion.